Hello, I am Dr. Suresh from Indian Institute of Public Health, Hyderabad, and today's lecture is on electronic surveillance for public health. This lecture gives an overview on the emergence and the need of e-surveillance for public health and also presents some working examples to further understand this concept. Now, why do we need e-surveillance? Let us consider some present facts in present public health. One, non communicable diseases like diabetes, cardiovascular diseases, hypertension, and cancers are on the rise, as you can see on slide 3. Two, despite consistent efforts, large parts of the developing world, again shown on slide 3, has a high disease burden due to communicable diseases. 3. There is a new basket of emerging and re emerging diseases facing both the developing and developed countries, as shown in slide 4, which could possibly be because of increased blurring of human animal interface or living conditions. Slide 5 is a summary of these three facts. These facts are stressing public health surveillance by making conflicting and challenging demands. Let us consider the dimension of time first. Non communicable diseases not only require surveillance over a longer period of time but also require information to be analyzed continuously, meaning shorter reporting time. With regards to place and person, as human population and habitation areas expand and people move around more and more for several reasons, less and less resources are available for surveillance. Conventional methods of disease surveillance are no longer seen effective in these scenarios where volumes, velocity, variety of data to be processed are phenomenal. As effective surveillance for public health requires timely, accurate, and reliable information from a wide variety of sources, public health professionals have been amongst the earliest adopters of computers, informatics, and other emerging technologies. What are the benefits of informatics-based surveillance or e-surveillance? If you look at this slide, it highlights the generic structure of benefits that any informatics-based system is probably bound to have. I personally think it is necessary to understand the generic structure and then apply specifically to understand the significance. Let's start the benefits on the top right. With regard to time, place, and person, informatics can help surveillance to expand, resulting in more quantity. Informatics also brings in metadata like time, location, user details, automatically increasing the quality of data. As surveillance expands and it becomes more economical, it starts a virtuous cycle of scalability, sustainability, and reaches out to people of all socio-demographics, resulting in all important equity. Integration of informatics systems can be relatively easier and even done remotely, leading to better coordination, comprehensiveness, and convergence. I'm hoping that at this point of time our lecture, we have an understanding on the emergence, the need, and probably the benefits of e-surveillance for public health. Let's refresh on what surveillance is. It is the ongoing systematic collection, analysis, and interpretation of outcome-specific data for use in planning, implementation, and evaluation of public health practice. The key word here seems to be the data. And the question is, where do we get the data? Traditionally, data has been collected from several sources within the health system and also from related sources. The graph on slide 9 compares the specificity of data versus effort spent. The best source of disease data is probably the confirmed lab report from any accredited lab. However, at this stage, the disease is also probably advanced. Identifying sources of data where signs and symptoms can be identified early is crucial for effective public health surveillance. The downside of identifying early is lower specificity and higher effort, as shown again in this graph. In today's world, most of the listed data is electronically generated and hence relatively easier to collect, mine, analyze, and interpret. Mining online news reports and data generated from social media is the latest source of data that promises to bring a sense of proactive, real-time dimension to public health surveillance. The WHO organization, the World Health Organization, has taken the lead and has proposed the Global Outbreak Alert and Response Network, you can even call it as GONE, as a technical collaboration model of existing institution and informatics networks for the rapid identification, confirmation, and response to outbreaks of international importance. The concept of informatics based data sharing began far early though. It started with ProMed Mail, which is an expansion for, which is a abbreviation for Program for Monitoring Emerging Diseases, a program of the International Society of Infectious Diseases. And then came GeoSentinel, which was a clinician based sentinel surveillance of individual travelers from the International Society of Travel Medicine and CDC. If you want to know more information about this, please Google up and then you'll find plenty of information. Eurosurveillance was launched by peer-reviewed European Information on Communicable Diseases Surveillance and Control, and this was published by the European Centre for Disease Prevention and Control. Next came HealthMap, which is a freely accessible automated approach to organizing data about infectious outbreaks according to geography, time, and infectious disease agent. And this is a multi-stream real-time surveillance system that aggregates multiple web-based data sources. Currently, the newswires, RSS feeds, ProMed mailing lists, and the Eurosurveillance and WHO alerts. There is a short video that describes HealthMap. Please do watch.
Every day, our world is threatened by infectious transmissible diseases. Communities are unknowingly exposed to local outbreaks and growing epidemics. With today's wealth of information, it's hard to achieve a unified view of the current state of our global health. The way we access health information is about to be revolutionized. With HealthMap, the world community can come together in real time. The HealthMap automated processing system collects data every hour from tens of thousands of sources. Disease and location patterns are extracted from these sources and reports are categorized with over 90% accuracy. The result is a free, rich database that HealthMap presents in a user-friendly way both online and on mobile devices. Through HealthMap, you can find out what's happening where, filtering by disease, location, and number of cases. View maps of where you are and where you're going. Create, save, share, and comment on maps, alerts, and outbreak warnings, and educate yourself about symptoms. HealthMap has become the most precise data source for health officials in their fight against the spread of international pandemics, as well as an asset for international travelers and concerned parents. With this information, we can be prepared, educated, alert, and proactive against infectious diseases. Because increased awareness in your world means a healthier world for all.
Thanks for watching and coming back to the lecture. GPIN is an early warning system that takes advantages of existing information technology to continuously scrutinize news media sources through news aggregators who have contracts with newspapers around the world and as well as with health and science websites. The multilingual system gathers information by monitoring global media on a 24/7 basis and in 9 languages, including Arabic, Chinese, English, Farsi, French, Russian, and Spanish. The Global Public Health Intelligence Network is developed by Health Canada in collaboration with the World Health Organization. And finally, the Global Outbreak Alert and Response Network has been proposed as a technical collaboration of existing institutions and networks to pool human and technical resources for the rapid identification, confirmation, and response to outbreaks of international importance. The network provides an operational framework to link this expertise and skill to keep the international community constantly alerted to the threat of outbreaks and enable them to respond readily. The GONE focuses technical and operational resources from scientific institutions in member states, medical and surveillance initiatives, regional technical networks, networks of laboratories, UN organizations, the Red Cross, International Federation of Red Cross, Red Crescent societies, and international humanitarian non-governmental organizations like Medicine Sans Frontiers, International Rescue Committee, Merlin, and Epicenter. The future of health surveillance, at least according to the WHO and GONE, is clearly electronic, and it will be heavily dependent on e-news and social media networks. The slide shows a schematic representation of an informatics-based surveillance system. And in this, there are three major components. First, the data collection segment, where data from different sources in several formats and structures are sourced automatically. And then, second, the advanced analytics, which will screen for duplication first, identify the spatial temporal relationship, categorize and rank or weigh the information. The last segment is when, depending on the rank or weight of information, the information will be placed in a variety of contexts and made sense of in relation to e-surveillance. This type of e-surveillance is still in its infancy, and our lecture and our website healthinformatics.in will update more details on the methods, setting, and outcome efficiencies shortly. Presently, though, there are some obvious issues in e-surveillance system. Only news feeds from some major languages are machine readable and analyzable. However, healthcare incidents are more covered in regional and local newspapers than in national editions, unless it is nationally relevant or important. Lot of information from news sources is not structured in a way that keywords are instantly recognizable. Identifying relevant information from all that is offered, which is a lot of noise at the present, requires a tremendous amount of computing power. However, even with all these things, there are advantages. The data is sourced directly or with 1 degree of separation. Metadata with time, location, and other features are captured for more reliability, and the data stream is continuous and automated with minimal resources spent. For the collection side, we at Indian Institute of Public Health, Hyderabad, have started up an experimental project with the objective of mapping with high accuracy GPS-based primary data the spread of health and social care providers, the spread of health and social care recipients, identify the gaps, and try to scientifically and spatially visualize and optimize the services for various health and social care settings with the help of geoinformatics systems. Some of our preliminary work is shown in this slide. Please visit the website www.geohealthcare.in for further details. Simultaneously, we are mining electronic newspapers and social media for certain basic healthcare text and map the spread of sources. We believe this exercise will show us the scope of coverage of social media and e-newspapers in relation to disease surveillance. We are working on exploring the potential of drones in the area of remote wireless data collection, the use of live view cameras for video data collection, and also the role of drones for medicine delivery to remote areas and medical emergencies. Please again visit the website www.geohealthcare.in for further details. Please watch the video on Project Premonition, a system that aims to detect infectious disease outbreaks before they become widespread with the goal of preventing major health disasters. Project Premonition could eventually allow health officials to get a jump start on preventing outbreaks of a disease like dengue fever or avian flu before it occurs, whether or not it is a disease spread by mosquitoes.
The overall goal of this project is to monitor infectious agents as they move across the planet. So in the end game, we'd like to have a global system available that detects new infectious agents and then monitors their movement as they emerge. In this way, we could intervene before they become an epidemic or before they become an infectious problem for humans or wildlife.
The mosquito is the most dangerous animal on the planet because it carries so many pathogens. What we want to do is to be able to catch that mosquito efficiently, at scale, and at low cost.
Current collection technologies are very limited and present a lot of biases. When we do this in the field now, it takes a lot of effort and money and personnel time. The big challenge is going to be creating new traps that can collect mosquitoes that's drone portable and that can be automated in a very efficient way.
What our team will do is take the mosquitoes and then deep sequence them. The results of that sequencing will be place through a series of computational steps that will detect viruses and will distinguish between viruses that are known viruses and those that are novel viruses. So right now our ability to analyze these sequences depends on computer power. We're going to have to expand our computational power, and we're going to have to develop new algorithms that can process the data much faster.
What we want to apply to achieve a goal like this are our advanced operating systems, analysis tools to find bugs in software before they're in the wild, machine learning and vision to add complex autonomy into these drones so that they can make decisions. And then finally, cloud computing and genomics so that we can at scale analyze the complex data we obtain. I believe in the next 5 years, a system like this is attainable.
Please read the article mentioned in the references for further understanding. Thank you for joining me in this lecture. Please mail me at s.munuswamy@iiphh.org for any comments, queries, and further research. Thank you very much.